At 8 o'clock last night, hundreds of thousands of people showed their support for the NHS by standing outside homes and applauding. And there is, in fact, plenty to be grateful for, as well as the personal commitment being shown by individual workers. Hospitals around the country have been ramping up their capacity to deal with coronavirus victims. Dorset has a higher number than average of older patients who are, of course, more vulnerable. Well, we can talk now to Debbie Fleming, who's Joint Chief Executive for Poole Hospital and also for the Royal Bournemouth and Christchurch Hospitals Trust. Good morning.
Good morning.
Given the profile of your population, this must be a worrying time for you, I guess.
It's a hugely worrying time. I think it's worrying for everybody, isn't it? We're all people, wherever we're working or living at the moment, and all of us are working together in the NHS, both locally and nationally, to absolutely do the best for our patients and local people. Really, really challenging times.
And how have you been able to expand your intensive care capacity?
Well, do you know, when I agreed to do this interview this morning, I was just thinking how I just wanted to say how hugely proud and impressed and how humbled I've been by all that's been achieved over the past few weeks. We have done things together that we never thought possible. And so if I look at the intensive care capacity, and this would be actually, there's 3 hospitals in Dorset. I look after 2 of them, but working with my colleagues in the West as well, we have been significantly able to make plans and start implementing those plans to expand intensive care capacity and also our bed capacity in general through the support of our partners in the community. So, for example, we have at the moment in my hospitals, one of them currently is 15 intensive care beds. That'll be going up to 50. And in another, it's going up from 12 to 31. And similar in the West.
So that's quite an expansion, yeah.
And
I was wondering, do you have the kind of equipment that you need? Do you have protective equipment, enough protective equipment for your staff? Do you have enough ventilators?
So clearly this has been one of the biggest issues because for us, our top priority in trying to provide great care for our patients, we have to look after our staff, and our staff safety is absolutely paramount. So yesterday we had a really helpful announcement and new guidance around the PPE, the personal protective equipment, and that's really encouraging. And we are assured that that supply chain is now in place. There's been lots done, so much done to unblock blocks and to make things possible. And again, with national colleagues, regional colleagues, we are all feeling more confident, though I think staff have been hugely worried and very frightened, and we've seen that playing out in the media. In terms of the ventilators in my organisation, for the plans that we've got in place, we have got the equipment that we need to rise to those numbers. I think what we're looking at, though, is we still need to do more. And looking at all of the surge that we're expecting, our greatest message, of course, is please to the public, do please continue to do the social distancing, because what we need at the moment is for people to flatten that curve so that we can manage the demand as it comes in.
Understood. And finally, we've heard from the Health Secretary that he's writing off the debts of hospitals. What difference will that make to you?
Well, obviously, at the moment, it's been hugely helpful that people can focus on putting in place what's needed. And we do know that we've been told nationally that whatever we need to put in place to rise to this challenge, we must do. And we have. And staff have been brilliant and absolutely incredible. And thank goodness in all of this, we haven't been thinking, how do we do that within a very, very tight budget? We have been authorised to spend what's appropriate and necessary, recognising we need to account for it, but we're doing all we can to rise to this coronavirus challenge.
Debbie Fleming talking to us from Dorset. Thank you.